The journey from Germany to South Africa in 1997 was quite a jump for me, but obviously with Cape Town as the city and the German-speaking Catholic community as the field of work. And obviously as a Catholic priest, I do whatever the parish council chairperson is telling me, and therefore I said, yes, I'm willing to do something. Obviously, not having in mind a big organization, it was really just to help in those times to support the doctors and the nursing staff.
I was introduced to Hope Cape Town 20 years ago. He came to me in 2001. The reason why he came to the clinic is that they have this idea of having Hope Community Health Workers on board. And I said, no problem, I will support you. Constance Mayaba was the first community health worker appointed under my wings as facility manager in Mfuleni Clinic.
The very beginning of Hope Cape Town were actually not planned around sitting around a table and thinking, what can we do? When I arrived in South Africa, I joined a Rotary Club, and one of my first tasks as a Rotarian was telemedicine, to connect Tygerberg Children's Hospital with Worcester Hospital. Doctors came to me and said, listen, we have another problem, HIV/AIDS. Could you help us? The first thing what we did was actually establishing the ward G7, the Itemba ward, because there was nothing. 20 years into the pandemic, there was nothing when it came to the teaching hospital. The second was simply trying to save lives. That means we're in to bring antiretroviral treatment into South Africa and to kids. So we really were at the forefront of administering antiretroviral treatment to children and to save their lives. Very quick decision was to look, where are the kids coming from? Because when a kid was sick at a township clinic, the nursing sister took the child to Tygerberg Hospital. So the parents never had any contact with us, which also meant when kids were dying, we didn't know whom to inform. At the end of the day, it's about what people need to live and what people have to do, that at the end of the day, there's life to the fullest. That is what it's all about. The rest is the cherry on the cake, and you don't need the cherry on the cake.